Hi, everyone. I also want to give an acknowledgement. I acknowledge the Whadjuk Noongar people as traditional custodians of this budja or land and the beautiful waters of the Derbarl Yerrigan or the Swan River as the waters of the Waggle, the rainbow serpent, and the giver of life, which flows near my home here, where I am currently in Boorloo, Perth. I acknowledge all First Nations on this call and throughout the country. I also acknowledge our many allies who walk with us on this journey towards equity and reconciliation. And I will encourage everyone joining the call tonight to acknowledge the country that you are coming here to us all on, and you can pop it in the chat. And along with any questions that you might have throughout the discussion tonight, please feel free to type it in the chat and we'll come back and we'll visit it at the end of the conversation. And this tonight, I asked that, or we all at Croakey asked that it be a respectful conversation, and just also acknowledging that the opinions may vary on the various issues that we discussed tonight. So just, want to be respectful towards others. And so, I'll just share a little bit about myself before I pass it on to our panel members tonight. So Kaya, hello everyone. I'm Jade Bradford and I'll be your moderator tonight. I've been a casual freelancer at Croakey Health for nearly 4 years. My heritage is mixed, both Noongar and European, and I'm connected to the Balladong Noongar people, which is a couple of hours southeast of Perth. That's on my father's side, and my grandmother, rest in peace. She was a member of the Stolen Generations, and I was exceptionally close to her, and I spent a lot of time with her as a child. And it was during this time that I became aware that she was unwell and that her spirit was very sick. And this was from the abuse and trauma that she had endured during her own childhood in the institutions. And in my family, it was forbidden that we ask any questions relating to our upbringing or speak of our heritage. And so as a child, I powerlessly watched her succumb to her alcohol abuse, and well before it was her time. And so as soon as I was old enough, I began FOIing government departments and digging up my family's Aboriginal affairs records. And I also began searching for lost family members and connecting with them and hearing their stories. And that's been an emotional and challenging process of reconciliation within my own family. But it's one it's helped me. It's brought understanding, and it's brought my family closer together. And later on I became a journalist because I wanted to assist other Aboriginal and Torres Strait Islander people that were facing similar challenges, and for them to feel safe, and so that they can speak up and share their own stories. And so that was in the hope of the Australian public, that they would listen and understand the many issues stemming from colonisation. And I've also assisted in the research and development of a resource called Passing the Message Stick, and that's a messaging and communication guide for First Nations advocates and also our supporters. So to wrap it up, to me, the Voice referendum, it presents us all an opportunity to come together and elevate First Nations to be the rightful people, to be voicing input towards solutions on the matters that are affecting our lives. And I guess I'm really looking forward to this next chapter. And so, yeah, I'd like to pass on now to Fiona Cornforth. Can you please introduce yourself and tell us what's your connection to the voice and how does it connect to you personally and with the work that you're doing?
Yeah, thank you, Jade. I want to just start by joining you and Melissa in acknowledging country too, and custodians of country, community as well, and our connections to custodians and community. I want to pay my respects to elders of the dreaming and of the here and now as well. I'm coming to you from Ngunnawal country, home of the Ngunnawal and Ngambri custodians, and I want to express my gratitude for all that they do to guide us here as we undertake some pretty important roles in our organisations and in community. And just acknowledge all First Nations peoples too in this conversation. And thank you, Jade, for your courage, not just in your journey, but bringing your story to us tonight and your family story. Having just been the CEO of the Healing Foundation and before that the inaugural Deputy CEO, there are stories that I'll carry with me for life, and I see that as a really big privilege and honour. But there's this fire in my belly to get as much response as possible to their stories. So the connection, I guess, is through having a role like that, or that leadership role in a community-controlled national organisation like the Healing Foundation, and understanding how many of these processes have been kicked down the road for years and years without getting any full recommendations addressed or responded to in any meaningful way that changes course for survivors of stolen generations and other colonisation acts. I want to say too that I had a big career in education, and I was at the ANU trying to recruit as many students as possible to Aboriginal and Torres Strait Islander students from all over the country, also prior to being at the Healing Foundation, to inject our perspectives and to change the way learning happened around who we are as a people and what we have to offer. And we are the backbone of industry. My family, I've got these amazing stories in my family about being the backbone of industry when there wasn't any technology. We were building railroads. We were doing the diving and navigating across the seas. There is so much that we've given to this nation. And there is so much excellence to honour. And I want to go further back now and say that I started my career as a cadet in ATSIC, and actually my mum and dad moved us off country because they weren't very happy with the education system where we are on the Torres Strait, in a very remote community. They want all of us going to boarding school. And so they took the opportunity with a lot of my aunties and uncles and family, friends, family, to move to Canberra and build and establish ATSIC, the Aboriginal and Torres Strait Islander Commission. And eventually I finished my schooling. I became a cadet there, and I saw it. I was a part of the agency or the commission when it was torn apart. completely dismantled, and we ceased operations, and I was farmed out to the education department, and it was a really, really sad time. I remember that clearly, and those stories quite clearly as well, because there is a pain that you carry when you're making all these inroads at the UN, for example, when you're having a big say in the United Nations, the rights of Indigenous people, and all of a sudden that's all taken from you, and you then have to rely on this mainstream way of operating, where there is a lack of knowledge, where there was a lack of knowledge. I remember the commissioners and the councils writing their own health policy, for example, and you could not be a policy officer in health unless you knew that policy back to front that they'd written. And I remember some of those policies quite clearly, and they're very consistent with what we've drafted in the health plans now. So there's been this big, horrible journey back to where we've started. You could definitely argue that, because something like ATSIC was just closed down. And so that, to me personally, to see all the hard work that went into that, and yes, there were lessons learned. Yes, it wasn't perfect, but it was something that we should have built on. And so the idea of having something enshrined in the Constitution so it can't be taken away, that our voices are there always, that the average Australian can say, we're not okay with what's happening here in terms of suicide rates and incarceration. What does the voice have to say about this? And are you listening, politicians? Are you listening? That's what the voice means to me. But I do want to say too that my role, and I am on the referendum engagement group appointed by Minister Burney, I've seen it as to take the fear and confusion out of the conversation. And so I've worked really hard to try and be a safe person to come to, and for anyone to say how they really feel about the process, and to try to ground people's assumptions in truth, and encourage them to let go of things, misinformation, disinformation that isn't serving them. And I've been able to talk to a lot of workforces, into the thousands now. A lot of communities have called me to come along and have these conversations with them. And I do not shove yes down people's throats. I really just want people to feel safe in having a conversation about, and feeling that they're confident in as much knowledge as possible going forward. That's really working for me and my style and the way I lead, and I'm affirmed in that approach to again, my role in this referendum work. That's huge. Sorry, I'll leave it there. But it's a pleasure and an honour, and I'm grateful. Thank you.
Thank you, Fiona. I'm now going to pass it on to Kerry O'Brien. Could you please introduce yourself? Or I feel like you don't really need to introduce us to most of us here, but yeah, I'd be interested to hear your story, the story behind how you came to do the book with Thomas Mayo, and also curious to hear what you were doing at the time of the 1967 election, and what do you remember from around that time?
Thanks, Jade. Well, I'm a journalist. I've been a journalist since 1966, and I started out in Brisbane, so I would have been still in Brisbane. In fact, I'd just taken my first graded job out of my cadetship at a newspaper called the Queensland Times in Ipswich in 1967, in the lead up to that referendum. And I was still very raw at the time, and my knowledge, like practically everybody of my generation and all the generations that had come before me, I knew almost nothing. about Indigenous history, Indigenous culture, Indigenous civilization. I knew very little from my schooling. Again, almost nothing about the true history of colonisation and how Australia's convicts who became the settlers, the white settlers, how they came about their story of prosperity, which was the story of my own ancestors. My ancestors came to Australia. The first of my ancestors came on the 2nd and 4th fleets in the early 1790s as English convicts. And then subsequently I had Irish immigrants arrive as refugees in 1850 into Queensland, refugees from the famine and refugees from their own harsh and tragic stories of colonisation. So I actually voted in the 1967 referendum. It was my second vote as a 22-year-old, and because in those days you had to be 21 to vote. So I voted in that referendum with the bare bones of a kind of burgeoning knowledge, if you like, that something was fundamentally wrong with our country, that we had to have a change in the Constitution to essentially acknowledge Indigenous people really for the first time, having excluded them from any writing of the Constitution back in 1900, 1901, and to give our national government the capacity and the right and the responsibility to make policy for Indigenous people, to actually include them formally in the national census for the first time. Those things obviously rubbed me and caused concern. But my education process really took off in a very significant way when I visited Alice Springs as a young journalist in 1970 on a totally unrelated story, but had my eyes opened wide to conditions of Indigenous Australians in Central Australia, and spoke to a lot of people, non-Indigenous and Indigenous, to learn something about the why I was seeing the raw racism that I was there then. And I subsequently came back there in 1975 for Four Corners, still as a young journalist, still learning, covered a story of a brutal murder of a young Indigenous woman and the railroading into prison of 6 young Indigenous men who were still boys, really, for that murder when they couldn't possibly have written the confessions that were attributed to them. And it was a story really of 2 white men, one a Uniting Church pastor, Jim Downing, who, having gone to Alice Springs from Redfern in Sydney, took it on himself to learn Pitch and Jarrah, and was therefore able to give evidence in the Supreme Court that freed those young men, that they could not possibly have said the things that the police had purported that they'd said. And a young lawyer named Jeff Eames, who subsequently became a Supreme Court judge and was the counsel assisting the Royal Commission into Black Deaths in Custody. He was the lawyer who took the cases on and also steered it through and secured their release. And the Whitlam government announced a Royal Commission into relations between police and Indigenous people in the Northern Territory as a result of that. But 5 weeks later, they were sacked. Malcolm Fraser became Prime Minister and the Royal Commission disappeared. And we had to wait, Indigenous people in particular, had to wait another 12 years before the Royal Commission was established into Black Deaths in Custody. Also as a result of a Four Corners program, not mine. It was David Marr, a very well-known journalist. Those were the things that woke me up to Indigenous issues. And in the 55 years, I've seen stories of tragedy and pain, way too many stories of tragedy and pain. I've seen stories of hope too, but I've seen, and this is coming back to your original question about how I got involved in this handbook on The Voice with Thomas Mayo, is that Thomas had seen the need for such a book leading up to the referendum, and he approached me because he and I had got to know each other a little, and he had some idea of the things I had learned, the things that I'd begun to feel passionate about as a result of my work as a journalist. And he felt the book needed the perspective of a non-Indigenous person as well as himself as an Indigenous writer. And so I saw the good sense of what he was saying and was very keen to be a part of it. I saw it as an enormous privilege. I mean, I suppose the most important thing that I personally have brought to that book, which is really about trying to lay out what the voice is about and the background to it through the Uluru Statement from the Heart. It is such a simple proposition. There are those who are arguing, amongst those who are arguing against the voice, are some who've seen the need to mislead, outright lie in some circumstances, but to confuse the picture. And we set out with this book to lay it out in its simplest terms, to deal in the facts, as I've endeavoured to do all my life as a journalist. And the fact that nobody has been able to find a single flaw in this book, and I can just imagine that those who oppose the voice would have gone through it with a fine-tooth comb. So I think and hope that we've succeeded in delivering a book that is honest in what it covers, and that it has helped for many people to actually clarify this clouded issue for them, and to help them to see just how simple and real the proposition is. That's essentially why I've come to do it. But what I started to say, the thing that I think I brought to it most is my knowledge of the history of previous attempts to establish a voice to Parliament. After the referendum in '67, Harold Holt was Prime Minister then, and his idea of a voice to Parliament, an Indigenous voice to Parliament, was to appoint 3 white men to become his advisory body. And those 3 white men, one was they were outstanding human beings, the 3 of them, but none of them had an Indigenous background. Some had some Indigenous knowledge, but none had an Indigenous background. One was a former former head of the Reserve Bank, another was a former diplomat, and the third was an anthropologist. So the first truly Indigenous voice was Gough Whitlam in 1972-73. He established that there would be 41 delegates elected from the Parliament, elected from their grassroots Indigenous communities, and that they would advise government and Parliament on Indigenous issues. But Malcolm Fraser was elected. He basically wiped that one out and replaced it with a body with fewer delegates and with narrow voting rules. He went. Bob Hawke came along, and after a number of years, he introduced ATSIC. And listening to Fiona talk about her insight from the inside of what it meant when ATSIC failed absolutely resonated with me, because I know it. I covered those issues. And John Howard, when John Howard replaced Paul Keating as Prime Minister, ATSIC's days were numbered, because John Howard had opposed it from opposition. He had said that ATSIC would create a black nation within our nation. That never happened, and despite the fact that his own review, a review that he himself commissioned to examine ATSIC, despite the fact that review recommended that ATSIC should survive, that it needed to strengthen its roots with regional Australia, with regional Indigenous Australia, but that it was well worthwhile and should survive, he sacked it anyway with the support of the then Labor opposition under Mark Latham. And I know from my memories of the time and from what other people have said subsequently that how Indigenous people were cast adrift right around Australia when the ground was the rug was pulled from under them. Hundreds of millions of dollars was taken out of regional and remote communities, infrastructure programs, vital health programs, and so on. And what has happened since, the various voices that have been appointed since, this sort of checkerboard of voices, the same pattern. With each government that's come and gone, so have the voices. And so when Fiona says that she's looking forward to this permanent body as a result of a constitutional reform that I believe is vital for this nation, that is the purpose. The purpose of a voice to Parliament under the appeal of the Uluru Statement from the Heart is to provide it with that permanence, so that a future voice can be allowed to grow and mature and evolve and change and correct itself, and the Parliament would actually the Parliament would be the guiding force in a sense. If the power stays with the Parliament, the voice can't order the Parliament what to do. It lives and dies on the strength and the integrity of its advice. But the Parliament will have to listen, purely because the people of Australia will have said, we want this to happen through a vote in the referendum, and it will be very hard to ignore. So the purpose of, I've made no secret of the fact I'm an ardent supporter of seeing this get up. But by the same token, Thomas and I were absolutely intent on providing a guidebook that was based in fact.
Thank you, Kerry. First Nations people, yeah, we are the one, we know what is best for us and we have the solutions. So yeah, that was really interesting share. Appreciate that. I'm now going to pass it on to Scott Willis. Could you please introduce yourself to the group and share your connection to the voice and how it connects to you personally and to your work?
Yes, thanks very much, Jade. I'm Scott Willis. I'm National President of the Australian Physiotherapy Association, and very proud to be the first Indigenous leader of the Physio Association, but more importantly, any large medical organisation Australia-wide. So it's quite an honour, a privilege, and really, really excited. Coming into physiotherapy in healthcare wasn't easy for me. I grew up on Darragland in the western suburbs of Sydney. And when I wanted to become a physiotherapist, I was disempowered because I was told by high school teachers that where I come from, I'm not brainy enough and I should look for a different career because physiotherapy is not for me. Wouldn't I like to go back and challenge that now in being the national president of the organisation that represents over 32,000 physiotherapists Australia-wide. So I think that really gives me the passion and the drive to really escalate that Indigenous people need a voice, but they also need a vision that they can be empowered to go on a path of what they want, not just what people are telling them to do. So when you look at healthcare, I think health is the most basic and essential asset to fulfilling human life. And from health you can build, and without it, everything is such more difficult. So I agree with Minister Butler when he said the greatest impact of the voice will be in health, because from my literature read and 30 years experience as a physiotherapist, action and safety are the most important conditions of good health. And the voice to me is about advancing action and also safety. And when I look at the Australian Physiotherapy Association, it's enabled me to actually go forth in my profession, but also in life as well, because through the Australian Physiotherapy Association, we actually live and breathe the yes vote now. We actually have our reconciliation action plan that we're really driving cultural safety training, really empowering our Indigenous, our Aboriginal and Torres Strait Islander members that are part of our committee that really drives where the Australian Physiotherapy Association is going. Without some of these consultations that we have with Aboriginal and Torres Strait Islander people, we wouldn't have a rounded, we wouldn't have a balanced view to make a decision from a board point of view. We've also seen development of what we call the Deadly Physio podcast series, which is really delving into truth-telling, telling about our past, telling about some of the stories of our ancestors, telling the stories of what we've been through, but also what we need, because as we've all heard today, and you said it, Jade, Aboriginal and Torres Strait Island people know what they need. They know how to achieve. They just need the enabling and the enabler to actually achieve it. And one phrase I always come back to, what's good for Aboriginal and Torres Strait Island people is good for all Australians. And I think when you look at the voice, if you empower someone, they're going to go above and beyond and make sure that it works. If you look at professional sport, what's the first thing that a coach will do? It will get the side together and give them some input into what the strategy is going to be in the sport, what their game plan is going to be. If a coach comes to the team and says, this is how we're going to play, it's going to fail because there's been no engagement, there's been no voice given to those players. In corporate world, when you look at a strategic plan, the CEO doesn't do that strategic plan from A to Z. They actually enable the whole workforce, the consumer, the employees, the employers, and all the external stakeholders in that strategic plan. There's no difference when you look at the voice. You want strategy to be driven by the people that are going to be delivering it as well. So again, I think the voice is one way of actually empowering Aboriginal and Torres Strait Islander people to actually achieve better health outcomes, to achieve better social outcomes, and actually drive Australia forwards to a great nation that we all know now, but it can be better as we all go forward as one. So I think for me, the voice is a no-brainer, as Kerry said. We need to have that in shine, because if it's not, political power is going to change that constantly, like we've seen over the last 20 or 30 years. So I think a voice is absolutely imperative to move forwards in reconciliation, but also in driving the Australia forwards.
Jade, can I just very quickly come in and just offer a couple of examples to back up what Scott is talking about? We had the great Fiona Stanley, a preeminent paediatrician and epidemiologist who has worked in this field for a long time and who has a global view of how effective health policies can be, going beyond just the basic health that they're supposed to be addressing in Indigenous communities, when those Indigenous people have had a say in their own programs. And the powerful point that comes out of what she's written to me is in particular, she was talking about the Nunavut community in Northern Ontario and Canada, because there are other countries where these things are happening. The template is there already for us. The results, she says, the results of bringing back Aboriginal birthing, for instance, included better birth outcomes, which was predicted, but also increases in self-esteem, reduced domestic violence, substance abuse, more children ready for and attending school. And that those were outcomes that weren't predicted when those programs were put in place. In British Columbia, another study of youth suicide in all the Aboriginal tribal tracts across their province over 20 years showed that some communities with very high rates of suicide and some with no suicides at all. And those with no suicides had strong Aboriginal councils, language and Aboriginal controlled services, health, education and other. And what she argues off the back of very solid evidence is that giving First Nations people a voice is not only the right thing to do, the right practical thing to do. It is also economic best practice, which is a language that some people understand perhaps more than they understand on health and education and so on. Economically, it's the right thing to do as well. And there are so many examples of this.
Thanks, Kerry. I was just reflecting on my own experience within the education system. I was challenged as well, like Scott was. And when I actually left school when I was 14 years old, and I went and worked in shearing sheds, because that's what I was always told that, I wasn't smart enough at school. So I sort of, give up. And but I went back and I reclaimed my education later in life, and that's when I did my journalism degree. But the support network that I was able to access at the university here, and the Centre for Aboriginal Studies, and the mentors and the connection to my culture and everything that came along with it, that's what empowered me. So I can understand exactly where you're coming from. So I'll keep moving along, and I'm going to pass it over to Annie Butler. Annie, if you can please introduce yourself and share your connection to the voice.
Thanks so much, Jade. My name's Annie Butler. I'm the Federal Secretary of the Australian Nursing and Midwifery Federation. And I'd just like to acknowledge that I'm joining this webinar tonight from the lands of the Wurundjeri people in the Kulin Nation. And I'd just like to pay my respects to those traditional custodians and to all the traditional custodians of the lands we're all joining this webinar today, and to all the First Nations people joining this meeting as well. And thank you so much for the invitation to be part of this. From our perspective, it's probably no surprise, given the backdrop that I have here of what the ANMF thinks about the importance of the voice to Parliament. The ANMF did formally endorse the Uluru Statement from the Heart back in 2018, and so it was a natural follow-on for us that as a voice to Parliament was one of the key things being sought, that we would then enthusiastically endorse a yes campaign for the voice to Parliament. What I'd like to say, and thanks so much to the contributions of my fellow panelists, but perhaps just to build a little on that from a slightly different perspective. For those who don't know, the ANMF is actually the trade union, national union for nurses, midwives and care workers across the country. We have more than 320,000 members across the country, and they just work in every setting. And, you know, perhaps our members, Scott, obviously physios as well, and all health professionals, but nurses are so present and so close to pretty much everybody across the community. And so get to witness the very poor outcomes and consequences of the profound disadvantages in health outcomes that too many in our community suffer, but most particularly First Nations people. As personally, as I'm both a registered nurse and a unionist, I mean, as a unionist, it is just simply a question of fairness and justice and equity and also solidarity, but also as a registered nurse. I mean, a key principle for us is that we are taught and trained, educated to deliver care to those in need, regardless of anything else, to those in need. And the problem we've seen over way too many years is that the needs of First Nations people with regards to health just aren't met. And that's principally because decisions have been made about Aboriginal and Torres Strait Islander peoples without them, and been made for them, not by them. And so in nursing practice, a central tenet is what we call person-centred care. And what that means is a person can be an individual, it can be a family, a group, or a community, but they are, as exactly as it sounds, at the centre of care, involved centrally in the decision-making about their health and about their interventions, care, all sorts of things that are related to them. And so to us, the voice is just a natural extension of what we regard as central to our profession's being, as having the people absolutely centrally involved in making the decisions about their own health and well-being, about the decisions that affect them. And so we see that the voice is not the end, it's hopefully the beginning to allowing First Nations people to be properly involved in decisions around their health. And from our perspective, for nurses, midwives and care workers, the evidence is clear. When you are able to deliver full person-centred care, the evidence clearly demonstrates the improvement in health outcomes. Another thing for us that makes it we understand how important it is to have a proper voice is nursing and midwifery still remain to be predominantly female workforces. We're often referred to as the feminized industries, feminized professions, and our work has been undervalued, and too often the voices of nurses and midwives haven't been heard. And we know that unless we are able to have a seat at the table, not being asked afterwards or not being told how things would be, but have a seat at the table, is the only way we can affect change. And I use aged care as a really good example of this. For 20 years, we have been advocating and lobbying and calling for the changes that have finally started to occur in aged care. Unfortunately, we had to go through a royal commission and a change of government to finally get change. But we knew, we understood, could have told everybody 10, 20 years ago what was needed. But there was no formal recognition of our voice. There was no formal recognition of our input. But now that things have changed and we're starting, as nurses and midwives, we're starting to be asked, and most importantly, we're starting to be heard, change is starting to happen. So we understand that a voice for First Nations people is just absolutely critical to start to see, to stop decline in health outcomes for First Nations people across the country, but critically to start improving outcomes. And examples that Kerry touched upon, like birthing on country, we know that where we're seeing models of maternity-led models of care, birthing on country, and more we need to keep building on these models, but where we have actually Aboriginal-led maternity models of care and birthing on country, we just continue to see improved health outcomes, both for mothers and babies, but also, as Kerry mentioned, much wider impacts as well, beyond just that central family unit to the entire community. And when we think about it, and we think that before 1788, there were thousands of generations of healthy babies, healthy birthing, healthy children. And it only took 7 or 8 generations to just destroy all that. And so now we need to build that back. And for us, the voice is just the critical way to do it. Thank you.
I was just going to share quickly. I've just seen that Fiona, you've put in the chat about the response to the pandemic as another example of First Nations-led solutions. Yeah, so would you like to share a little bit more on that?
Look, it's just in line with those other examples, you know, birthing on country and community-owned models of preventing or addressing suicide, for example. You know, we know what we need to do. We just need our resources restored to be able to do it, and the pandemic showed that. We're able to use the values we were raised with, our collaborating, our joined up efforts, our strengths that we're born with, our expertise, all these things where we can contribute to our communities to actually protect our mob from something like the pandemic. There was little known about it, but we knew that we had to do something very, you know, we had to protect people with full force, and we did it. And we needed the decision making to be able to do it. It was a true act of self-determination. Yeah, a really good example from recent events.
Fiona, if I can just drop in again briefly, the issue of the pandemic, Indigenous leaders came forward at that time because there was this immense fear, justifiable fear, that as the most vulnerable people in the country, Indigenous people would be savagely hit by the pandemic, and in fact the opposite prevailed, because Indigenous leaders insisted on being heard, had a huge stake and say in how Indigenous communities and individuals would be protected through the pandemic. And it's in the book. In 1920 and 21, there were low rates of hospitalisation, no deaths, no cases in remote communities, and no cases even after the Black Lives Matter marches, if people remember them, when they were of how it was going to be spread. Indigenous populations had 6 times fewer cases than non-Indigenous groups. I mean, it's hard to find a more outstanding example of what happens when you listen to the wisdom and the knowledge of Indigenous advisors.
Absolutely, and we were sharing that knowledge globally too in live timing, because there were other Aboriginal Indigenous communities across the globe suffering, elders passing, and you know, we were joining up and having phone calls in the middle of the night, and it were these not your usual leaders that you see in the media all the time too. It's the ones on the ground who know their communities back to front, and they're just doing the work that they do. Again, just contributing their strengths and their talents to the local community. But all those efforts joined up, and getting behind those leaders too meant that we achieved something that was unforeseen. We prevented. And some people did pass, so I don't like using success or failure, for example, but I do know that, you know, we were better off, and we didn't. People decided that. I remember being briefed by, you know, the first secretaries of Department of Health. They just said, okay, we'll get this money to you, and you do what you need to do. Tell us what you need to do, and we told them, and then look what happened.
Yeah. God.
It's a really good example.
Some of those people who are scattered right around Australia could end up being selected from their communities to actually become the voice. That's the sort of ability that's there.
Yeah.
The next question I have for the panel is, I'd be interested to hear if you wouldn't mind sharing some of the campaign activities that you may have been involved in, and just any reflections on that you might have, things that you've learned along the way, if anyone's keen to share.
I'll share a couple of things if you like, Jade. So our union, we have branches in every state and territory, and we have in some of those branches, we have First Nations reference groups as well. Sometimes they're called branches, but and so we've been trying to hold some webinars like this with our First Nations representatives, ANMF representatives, to try and give education and have a conversation and discussion with just our broader membership. We've also trying to put out that sort of explainer and communication out through our other forms of communications. And at each of our conferences, we've been having a focus on the Voice to Parliament and sessions. And I believe Kerry himself was with Thomas Mayo at our New South Wales conference. So trying to have as much many discussions, conversations, and just trying to keep building that message further and further out through our membership. And as I said before, there's a lot of nurses, and nurses do continue to be, physios are a very close second, but the most trusted professional in the country. And so people may have seen there's an open letter being published in the Australian today and the Adelaide Advertiser with, I think Melissa might have said at the beginning, more than 125 health organisations, and more organisations are wanting to join that to try and explain to people the importance we think the voice has for improving health outcomes for First Nations people across the country. And I think that's an important thing for people may not have considered, especially with the negativity that's abounding in the media. They may not have considered issues like health and what that means. And we think it's important that those trusted voices are really speaking out, and maybe people will start to listen to that a bit more.
I think that's absolutely right. Absolutely right. I was just thinking as you were talking, 320,000 members, if 100,000 of you were to take it up, even just within your own circle of family and of friends and of colleagues, and acquainted with just those basic facts and a simple understanding of what it all means, and taking the fear out of it and the misconception out of it, that's a rolling force. And then if you apply that across, I'm not sure how many different professional groups there might be that are plugged into this webinar, but if you're all doing this, I mean, assuming that you're all behind it, we keep reading about opinion polls. I don't think that the trend, I don't think we can deny the trend, but I have serious skepticism about the accuracy of the figures. And we've got nearly 3 weeks left, and I think there is every chance still that we can see the right outcome emerge from this, because I refuse to believe that a majority of Australians do not have the desire to do the right thing here. So really, the scope that we all have to make a difference in these next vital 2.5 weeks, do not underestimate what you can do personally or within your organisation or as an organisation.
And just from that, Kerry, sorry, can I just ask the panel what their personal calls to action have been, and what you would encourage other people that they could do?
I think from my point of view, the personal action is taking the emotion or taking the political aspect out of the equation. So from an the Australian Physiotherapy point of view, we've been really trying to focus on health and what the health impact will be, but also what the opportunities could possibly be as well. We haven't dwelled on the negative side of it. We've really looked at what the positive and opportunities that a voice would give, not just Aboriginal and Torres Strait Islander people, but all of Australia. So all of Australia will benefit from that. So from our call to actions, it's really attempting to demystify the political nature of it, stick to the health policy and health opportunities that we see day in, day out. And a classic example is here in Launceston, an Aboriginal medical service has cut the chronic disease management of patients of Aboriginal and Torres Strait Islander significantly more than the non-Aboriginal medical service. And that's a statistical analysis that's been proven. So again, if you provide a service that's culturally safe, culturally appropriate, and co-designed by the people that it's going to affect, you're actually going to see positive outcomes, not just for Aboriginal and Torres Strait Islander people, but all Australians. And that's the demystification that we've been trying to get through now.
Yeah, Fiona, do you want to? I don't want to keep butting in.
I was just going to add to what you and Scott are saying, and I think the most important thing you can do is, and this is mainly for the people who may not be up for it for various reasons, including maintaining, self-preservation, their own health and well-being, is to tell people why you're voting yes. Because that's you sharing your information about why it makes sense to you. It's really, really helpful. And it's supporting those people who don't feel safe having their voice raised during this time when our identity is in the public debate. So I would just encourage you to do that and grab your friends, your family, just have the conversation. We've only got 3 weeks, and encourage them to grab their people too and say, listen, this is why I'm voting, and I want you to know why.
Yeah. I've travelling around the country, as I've been doing with Thomas mostly, but also separately at times. I must have covered somewhere between 50 and 60 different events, talking to people both from a stage, but then afterwards mingling and talking and hearing their concerns and their experiences. One of the very unfortunate things out of all of this, it seems to me, is watching non-Indigenous people struggle to know whether they're doing the right thing in voting yes because they hear or they read that many Indigenous Australians are opposed to it. And I think, and yes, I'm speaking as a non-Indigenous person, and I certainly respect of all the people in this country, the people who have a right to form their own view of this are the Indigenous people. But But I think the perspective, the accurate perspective is that although there clearly are Indigenous people who think that the voice doesn't go far enough, and there are other, well, I don't know, I haven't seen many Indigenous people say it goes too far, apart from Senator Jacinta Price. But the fact is that there have been 4 opinion polls conducted specifically with Indigenous people around Australia in the last little while, and there has been a consistent response of somewhere between 80 and 88% support for the voice to Parliament being enshrined in the Constitution. So the vast majority of Indigenous people do support the voice, and I think it would be a good thing. I mean, the more that is heard from Indigenous people to non-Indigenous people, the better. I think it is pretty much an accurate reflection, and I think that I've seen the conflicted non-Indigenous people wondering, as I said, whether they're doing the right thing by voting yes, when in fact the statistics or the polls would tell you that you are.
Yeah. I think that's a really helpful part of, so what I would say is call to action is like everybody has 5 conversations. It's a very union approach, but everybody has 5, the circle of influence, and then they have 5 conversations. But with the facts, and especially when we're talking to, health professions, as health professionals, we rely on the evidence. So an evidence-based approach is what we do in our work, and an evidence-based approach is what we're using for this campaign. And also as part of the broader union movement, we're trying to also, have there's a lot of conversations that I've been having with volunteers, the S23 volunteers, the unions are volunteering, just trying to talk to as many people as possible and to have this conversation, as you say, Fiona, in a respectful and Scott, gentle way, and just get people to understand that really we think from our perspective, this is just digging into all Australians' generosity and kindness. An invitation has been extended, and let's just be generous enough to accept it.
Yeah.
Thank you, Annie. Thank you to the panel. I'm just conscious of time. I think we've gone a little bit over. I think I'm going to go straight over to Melissa Sweet and for her to wrap it up, because I don't think we have any time left for questions.
Thank you, Jade. If people have questions, perhaps they can put them in the chat, and we can always respond in the chat, or someone can jump in. I just wanted to see, I'm conscious we have our co-chair, Professor Bronwyn Fredericks, online. Bronwyn, did you want to add any calls to action? Anyone who follows you on social media knows you're a dynamo in this space.
I just want to advise, hi everybody. As Melissa said, I'm co-chair of Croaky News. I am a Guru Murray woman from southeast Queensland, and am calling in tonight from the land of the Yagara and Turrbal peoples. I have been for quite some time am an involved and supporter of the Uluru Dialogues, and very adamant advocate for the Dialogues work, but also Yes 23's work now as well, since they have got up and with the campaign. I want to thank all the panelists tonight for sharing their personal stories, but also their personal reflections and their professional reflections, and weaving those two together. And as you were talking, I was reminded of the wonderful Bell Hooks and Bell Hooks's work, where she said the personal is political. And I think we are seeing that played out everywhere with this campaign, and what you spoke to in regards to, your personal experiences and the professional experiences, and why you're voting yes, and why getting people to understand why others are voting yes, and them getting to do the same in the conversations they have every single day in their circles of influence, with their family, with the people they go to clubs and societies, and their sport with, sides of football fields, netball courts, school, all of those sort of things, universities. I mean, I'm in the university today. All of those are important, because personal is linked with the political, and we're seeing that on the daily all through media, but also social media, all through all other avenues in terms of events. I want to thank the panel for making some suggestions and giving suggestions of how people can talk to others and get involved, and how maybe one should approach the topic of the voice with other people. I do think it is important. We've only got, what, 19 days now? Tonight when I close my eyes, and tomorrow there'll be 18, and then the next night I'll close my eyes to sleep and there'll be 17. This time will go very, very quickly. You know, I was looking at some photos with my mum yesterday, and she pulled out the one, she keeps it on her fridge, but I noticed it's not there right now. And it's when, it was from the newspaper, but it was from when I and Megan Davis, Professor Davis, and Arnie Pat Anderson and Noel Pearson and Miriam Corowa and all of that crew were in the front of the Sydney Town Hall for the Sydney Peace Prize. And she said to me, while the Uluru Statement was given the Peace Prize, and it was public testament to the power that this offers and the promise and the hope that that the Uluru Statement offers, it has brought such unrest. And for me going forward, and I give that to you as well, to think about what it can bring, what the Uluru Statement, what voice treaty truth can bring us all. And that is about the hope and the promise and the peace that this can, you know, really start to bring to this country. And for me, you know, Australia is a good country. I just told these students today, it's a good country. You know, they love it. They have great time running around this campus. But you know what? It can be an absolutely fantastic country. It can be a super duper country. It can be all those super cadulistic, fragilistic. I mean, they all know those stories, kind of country. But we got to make it happen. And so, yeah, keep having the conversations, keep going with the fight. Every day matters. Every single day and every conversation matters, and every single vote will matter. Every single vote. So thank you for being here tonight.